Good morning, everyone. I think it's delightful now to try and shift gears to talk about some concrete reflections. Now we've got the beautiful overviews and so forth. So I'll try to put a brief perspective on what is the value and concrete issues and partnerships with patient organizations from the industry perspective, so to speak. And the case here is the DAWN2 study, which is the largest sort of scientific study of patient needs and family members' needs in diabetes, involving psychologists, doctors, nurses, patients, patient organizations, and policymakers in 4 continents. And it's designed and developed with patient organizations and involving patient organizations at the national level, as well as the global organizations of the International Diabetes Federation. This is an example of a long-standing initiative over more than 10 years, where the focus has been on involving patients, but at the same time building research that really highlights the voice and the life of people with the condition and brings the scientific tools and data to the patient organizations to show whatever stakeholders they work with what is the patient side of the story. And this has been going on for 10 years, so we thought that could be one other perspective on this. It's broader than medicines, but the premise I have here is that the broader field of patient empowerment and involvement has so many important learnings that can be applied in this effort now to ensure the involvement in medicines alone. And I apologize for being speed talking, but I did understand that we had a few minutes only. What I wanted to say first, as a reflection on this partnership on the DAWN2, as I see it, and reflecting on the Europathy, well, first of all, patient involvement creates value to all. And I think that's really important to emphasize that this is not one party wishing something, because we all seek the same target, as Michelle said. But that also means it's the responsibility of all parties. And I was just emphasize that from my perspective, that now we're talking about the empowerment and filling the empty seats, but we have to make sure there are empty seats to fill in terms of patient involvement. And it's a big ongoing struggle and hard work among organizations, including the industry, to ensure that we reform the way we work so the patient involvement is transparent, it's effective, and it's there. So that's my main point here, that we have to make sure that Europathy, based on these learnings, is really working to the broader shift of mindsets, and we have to be explicit about that. What we have seen by the DAWN studies, providing all this evidence of the patient's perspective, it's been effective through the partnership with patient organizations in promoting innovation by educating the R&D organization in the patient-centered perspectives. But it's also the foundation, the partnerships with patient organizations is the foundation for corporate responsibility and raising the bar for business ethics, because that is part of good ethics, to involve patients in all steps and in educating the employees about patients' issues, and most importantly, ensure sustainable improvement of outcomes by ensuring that the patient organizations and the wider community is supported in taking all the innovations into the real life, so to speak. So I do appreciate the time again, but I will say that that I think the key, of course, from the industry perspective in terms of best practices is that an example like the DAWN2 study has helped us through the work with patient organizations to involve patients in more of the phases of medicines and health research, and raise the debate internally about how to communicate effectively from a holistic perspective of persons as human beings and persons and not patients. And it has also some examples I wanted to raise about how to ensure that there is an organizational strategy that is top-down, that is really not top-down, it sounds bad, but that's top management supported, that clarifies patient centricity as a vision and a target, and of course the patient-centered research. And then the DAWN2 initiative is an example of what industry is doing more and more. I see funding larger partnerships that involve all the stakeholders to create this sustainable capacity development of the patient organization environment. And that is really a major challenge right now in many countries, that the patient organizations and the patient advocacy capacity is not strong enough. So this is a long haul. And big initiatives like the DAWN2 study and other studies similar to that, I think are pivotal to building that broader awareness of the value and importance of patients as co-developers of health policy and whatever other element of medicine's development we see. So just to stay to the very concrete part, patient sounding boards are a critical thing that is very challenging to do. We partnered with the International Alliance of Patient Organizations to set up rules of engagement for patient sounding boards, and found a huge interest from all parts of the R&D to engage with this group. And we see that evolving, but it's actually not so easy. It's very difficult. So we need to share the challenges and failures around what works there. And then mentioning also a toolkit that is available on the website of IAPO, which you may not have seen, which talks about step by step how to partner effectively and transparently, equally with industry and other stakeholders to achieve your goals for patients. And that is on the website of IAPO, and that was a partnership initiative as well, and that will continue with more companies involved. And then I wanted to highlight the other concrete example of the DAWN2 initiative, which I already explained as an international project survey with family members and patients to raise the voice and facilitate engagement among all stakeholders. One important finding we found here was that what was really important is not for us to engage so much with patient organizations, but facilitate that patient organizations through this are exposed to and get engaged with all the other stakeholders around these issues. So I think those are important elements in this. And the most recent study of the DAWN initiative, the DAWN2, is just completed and will be publicized soon with IAPO and IDF as major global patient organizations, looking at new scientific approaches to involving the patients in understanding how to improve healthcare. So that was a bit too fast. So I think that my key message, I think, number one before this is, it is a no-brainer. I think that patient involvement is the foundation for the industry to develop better medicines, for the industry to provide better services and communicate better about patients. There's no doubt about that. And also for ensuring the corporate responsibility in the long term. And every organization has that responsibility in this room to look at strategies, look at internal guidelines, look at how we are being accountable to these principles. And I hope that that's going to be part of your patty, to make sure that the rings in the water will spread and all organizations will take this up in parallel. And the importance of being transparent, of course, and the importance of building long-term capacity of patient organizations, not just on a single project or engaging one person, but it's really creating the broader capacity that is the feeding source for the experts in UPATI ultimately. So with those words, patient involvement matters, and it's each of our responsibility to be accountable to making that possible. Thank you.